Parkland Community Health Plan believes in improving every life we touch as good stewards of those we serve. With that in mind, we want to provide information and assistance to our members during the COVID-19 crisis. Our healthcare experts will offer you valuable insights through videos like this one. We have Dr. Barry Lachman, Medical Director for Parkland Community Health Plan, to discuss practicing healthy habits during the quarantine and what to do if you think you're sick. Dr. Lachman, welcome and thanks for taking the time to help.
Well, thank you for the opportunity to communicate with our members to help them stay healthy.
Well, let's start right with that. What are some of the things that people either need to start doing or continue doing to stay healthy during this crisis?
First, remember that all the things that you would normally do to maintain your health, you need to do. Take your medications, exercise, eat healthy foods. That's the first thing. The second thing, of course, is washing your hands in good hygiene. A good tip is to know if you've stayed long enough in washing your hands is to sing happy birthday. Secondly, practice social distancing. Stay 6 feet away from people in any situation where you're exposed, where you can. Third is staying at home, limiting any trips out to only things like grocery shopping that you really need to do, and thinking about things like pulling family to shop for more than one family. Anything that limits social distancing is very effective in cutting the spread.
That's good advice. So let's say we have members that are washing the hands, practicing social distancing, and they take you up on that advice and make sure they kind of pool resources so only one person shops. Despite doing that, let's say someone feels sick. They maybe think they have some of the symptoms. Can you walk us through to help clarify when we need to do something related to COVID-19 and when maybe it isn't the symptoms that we thought?
So there are a number of different things you can do. First of all, remember that COVID virus, first of all, presents often with fever. See if you have a fever, if you have a thermometer. Second, make note of all your symptoms. COVID is a virus that affects your respiratory system, your lungs, your nose, your throat. If you have symptoms that involve gastrointestinal tract like diarrhea or vomiting, it's not COVID. That doesn't mean you shouldn't take care of it. It just means it's not COVID. The second thing is call your provider. You will find that some providers now have limited hours or access, and you have several backups there. One is that many have telemedicine or telehealth options, and our health plan, we are paying to providers to provide that information. The third one is making use of the Parkland Nurse Advice Line, where you can talk to a nurse who will give you advice. I know that a lot of people are using social media sites, and I will just caution that you need to be careful in using reputable sites, things like Mayo Clinic, Johns Hopkins, the Center for Disease Control. Those are reliable. Other advice may or may not be as reliable.
So Dr. Lachman, you mentioned the nurse assistance line, which we put on the screen so people know where to go to find that. But you also talked about telehealth and telemedicine. Can you just give me a quick summary of what that is, maybe if a member has never done it before?
Yes, we have seen increasing use, particularly with this crisis, of you actually being able to do a video connection like you would do with an iPhone or an Android device, where you and your provider will be face-to-face talking about the problem that you have. Telehealth is more telephonic and monitoring types of services, or is done through a third party rather than a provider. So it may be like, doing a video connection to a nurse advice line or a behavioral health counselor, those sorts of things.
As a physician, you can tell members that you believe in this. You know, as a physician, that you can use telemedicine and it can work.
Yes, it's very reliable. Providers can do things, talking about telehealth, about listen to your heart over the phone. listen to your breathing over the phone. And they may be able to hear what's going on.
That's excellent. That's Dr. Barry Lachman, Medical Director for Parkland Community Health Plan. Thanks, Dr. Lachman, for taking the time.
Thank you. And everybody stay healthy, stay safe, and stay at home.
Parkland Community Health Plan will continually provide videos to help members during the COVID-19 crisis. If you need additional information, we've given you a number of sources, but you also have parklandhmo.com.